See, I'm Dr. Hymavathi Reddy Kaliki. I'm the Senior Consultant OB/GYN Department, Apollo Specialty Hospitals, Nellore, Andhra Pradesh. Today I'll be talking about gynecological health concerns in a female. So first we should know what is gynecology. It is an area of medicine which deals with the diagnosis and the treatment of diseases involving the reproductive organs of a female. Then the next question is, what is awareness? Awareness means one has to know what is happening in them or in their surroundings. So that is called awareness. We have to be aware about our own bodies, what is happening to us. So there are certain health concerns, gynecological, which a female has to know about it. So then comes, suppose if we take the life cycle of any person, it starts as a newborn baby. Then there are various stages in the development like childhood and adolescence, reproductive age group, premenopausal and menopausal. Menopause is the other end of the life in a female, I should say. Then when we come to the newborn, what are all the things happens usually? Many abnormalities which appear to the mother as something abnormal in the newborn baby, they are all physiological. Physiological means normal. Sometimes a female baby is found to have vaginal discharge, and the mother may find some bleeding through the vagina, and the mother may also find the breasts of the female baby is enlarged, and sometimes there will be milk secretion in the female baby's breasts, which is definitely look abnormal to the mother. But all these things are happening because the baby, when it is in the womb of the mother, it is influenced by the hormones which are there in the mother. Once it comes out, the hormonal influence will be withdrawn. So these are the symptoms that the baby is no more under the hormonal influence of the mother. So all these things, vaginal discharge, bleeding from a vagina, and milk secretion from the mammary glands, everything will be set right in a week or two. So nothing to worry about it. So a mother has to know about it. Then other things is, what happens in the baby is, sometimes as long as the baby is comfortable, anything happens, the mother need not worry, because it is the mother who will be all the time with the baby. She has to know about it. Sometimes immediately after birth, some calamity, the first question the mother or any relative asks the clinician is, what is the sex of the baby, male or female? But sometimes we may not be able to answer this question with clear cutness. So why? This is called ambiguous genitalia. Sometimes we may not be able to say. Very rarely this happens. That's why I'm telling about this abnormality in the last, because it is the rarely seen abnormality. We will not be able to determine the sex immediately after the birth of the baby. This may be due to some hormonal problems or due to some genetic problems. So when it happens like that, a multidisciplinary team of clinicians has to discuss among themselves, then they have to counsel the parents about it, what exactly is to be done. But this happens very, very rarely, almost not even 1% maybe. Okay, these are all the things that might happen in a newborn baby. Then what comes is the childhood, that is up to 9 years, it is the childhood. So what happens in the childhood? Again, the mother plays a vital role in guarding the child. But during the childhood, apart from the mother, it is when the child starts going to the school, it becomes the responsibility of the teachers also to take care of the baby, what is happening into them. So what happens in this childhood is, again, vaginal discharges may be there, and the child all the time try to scratch in that private parts, because she will be having very much itching. So what is the reason for this? Reason is, maybe there may be some infection. The undergarments are not cleaned properly. So the mother has to take care about that. And another thing is, Another common cause of vaginal discharge is, it is the foreign body in the vagina. It may be in the form of a tissue or a small toy or a pencil or an eraser, because how the girl knows about it means we cannot explain, but sometimes very often it happens. So once the discharge is very much there and once it is there for a long time, the mother has to take the baby to a clinician, and a child gynecologist will be able to identify the problem. If there is any foreign body, they will remove it. Automatically, this problem will be solved. Then sometimes there will be vaginal bleeding also in the child before 9 years. So it may be an accidental bleeding or a non-accidental bleeding. Sometimes the child will be falling on the edge of a table or a chair like that. So, but these injuries which happen with accidents are not very serious injuries. But non-accidental injuries are something very drastic, that is sexual abuse. Because we are seeing every day in the newspapers and we are coming to know from our neighbors something, a child is raped and something happened to a child, kidnapped and dead, something like that. So any type of vaginal bleeding the mother has to see in a child, and sometimes it happens because of the excess hormonal influence. The child starts menstruating before 9 years. That is called precocious puberty. So when bleeding episodes happens for a long time, or if the child starts menstruating every month, something like that, then the mother has to take the child to the gynecologist, because there they will do some investigation. Sometimes the thyroid problems also cause premature precocious puberty in the child. So these are some of the abnormalities that can happen in a child. So sometimes the vaginal bleeding may be due to ovarian hormones also, ovarian tumors. The tumors produce some hormones which are commonly seen in the children, these tumors. So when the child's abdomen is a little bulging is there, or when the bleeding episodes are irregular, something like that, the mother has to consult the gynecologist. So this is some abnormalities that can happen in a childhood. The mother has to look into that. Then the third stage of development is the adolescence. Adolescence is a hallmark event in the life of a female because it indicates the transition between childhood and the adulthood. So this is a little precarious period because the children who become adolescents, they'll be very, very sensitive and they are emotionally volatile. You can't expect them how they react for certain things and what they do for certain things. So here, either the clinician or the mother, they have to be very friendly with the adolescent child, because you cannot be an authentic mother to them and you cannot be a strict teacher to them. You have to create a friendly atmosphere. It is our duty to get their confidence. They must be able to feel that we are there for them. Then only they will be able to open up their problems. That is the problem with adolescence. So what are the various problems an adolescent female undergoes is mainly menstrual problems, because adolescence is from 9 to 18 years, even up to 19 years also is the period of adolescence. So during that period, the child may attain menarche and there will be painful menstruation. But many of them, they will not be able to say because they feel embarrassed to discuss with the mother or with the teacher also. Sometimes if the child becomes absent to the school, the teacher asks, why you are absent yesterday? The child will not be able to say because she is embarrassed to say that she is having painful menstruation. So, and another thing is ignorance about the facilities that are available to them. That also makes them not to open up the problems. So, a friendly atmosphere has to be created in the house as well as in the schools also, to make these children open up their problems. So one important problem is the child painful menstruation, which can be treated very easily with some tablets. And another problem is heavy menstrual bleeding. Some children will be brought by the mothers saying that my child is having menstruation, then afterwards 2 months she will not menstruate, then third month she will menstruate with heavy bleeding. So that also has to be consulted with the gynecologist, because every 3 months if the child is profusely bleeding, she will become anemic. Anemia is one condition which has got very severe repercussions in the reproductive period. That's why maternal mortality, mothers die of anemia to a considerable extent. That's why WHO has taken enough precautions to prevent anemia. Even Government of India has very much concerned about the prevention of anemia in the adolescents. Because if you prevent anemia in the adolescents only, the reproductive period will be successful. That is the idea. Okay, then apart from this, if we sit in the adolescent clinics, every alternate girl will have what is called a PCOD, polycystic ovarian disease. The main polycystic ovarian disease has got multiple problems, multiple etiologies, and it presents in different ways. Some people will say that they are having some pigmented depigmentation around the neck. Some people will come that they are having irregular periods, and some people they come that they are having excess hair growth on the lips and chin also. These are all various manifestations of polycystic ovarian disease. What is the reason now? Of late, the incidence of PCOD is increasing enormously because of childhood obesity and sedentary lifestyle, lack of exercise, and the increased popularity of the junk foods. The adolescent girls, they don't eat in the house, but they will go and eat burgers and all those junk food. This appears to be a common cause for the increased incidence of PCOD. So there should be some in the house also, there should be some atmosphere created for them to change their lifestyle. And in the schools also, they should be encouraged to have some exercise, to have some active lifestyle, and about their diet also. This should become a part and parcel of the health education in the schools. Okay, then other problems which an adolescent sees, again, there may be sexually transmitted diseases are noticed even in the adolescent girls because of aberrant sexual behavior. Because it may not be very common in places like ours, but in the West and all, dating has become very common, and live-in relations have become very common. So ultimately, they will, if they don't take proper precautions, they are likely to be subjected to sexually transmitted diseases, which will have severe repercussions when they become in the reproductive period. They'll have infertility because of the tubal blocks, because of these infections. The ultimate and the last thing is the teenage pregnancy. Because of this aberrant sexual behavior, not taking proper precautions about the contraceptive things, so they become pregnant. A teenage pregnancy has got many problems because they will have all the possible problems and they'll have hell of a life. So a teenage pregnancy has to be prevented. If it has to be prevented, again the role of the mother, role of the teachers in the school will come into play. The next stage is the reproductive age group. So what are the problems we face in the reproductive age group? Up to 40 years is the reproductive age group, from 20 to 40. So infertility is the main problem nowadays. Almost 15% of the total population, 15, they are having infertile problems. That may be due to the adolescent problems continuing also, sexually transmitted diseases not treated properly, or PCOD, which has become very common problem now. PCOD also leads to infertility. So these infertility problem is. Another thing is abnormal menstruation. Again, in the reproductive age group also, they will have heavy menstrual periods, maybe because of some tumors in the uterus like fibroids or ovarian tumors, which may be there. So in the reproductive age group, problems are mainly menstrual problems and infertility, we should say. Then after 40 years comes the premenopausal period, that is 40 to 51 years. That is the premenopause. The woman is reaching the menopause, but she is not yet menopause. Menopause means absence of menstruation, cessation of menstruation. So in the premenopausal group also, the main problems that we see is abnormal uterine bleedings, abnormal menstruation. They will have irregular periods. They will have heavy menstrual bleeding when they have the period. So it may be due to the hormonal disturbances that is occurring after the age of 40 years. But at the same time, after 40 years, any abnormality in the menstruation has to be looked with great concern, because when they consult a gynecologist, any possibility of malignancy has to be excluded in this group of patients, that is in the premenopausal group. Then from after 51 years, because globally the menopausal age is around 51 years. So after 51 years, the menopause starts. Now, menopause is another hallmark event in the life of a female, because some people menopause, it comes uneventfully and it continues, but some people, they face the menopause very seriously because it starts with hot flashes. The woman suddenly feels hot and sweats, and we do not know when this hot flash comes. Suddenly in the middle of the night when she is in sound sleep, she'll get this, and the whole night will be disturbed. So like that. Then postmenopausal bleeding episodes are also very dangerous. Any woman after a cessation of menstruation for more than a year, if she has observed any vaginal bleeding, she should immediately consult a gynecologist. She should become aware that this may be a serious problem. This may not be serious at times, but you must prove it that it is not serious. That proving that it is innocent bleeding will happen only once she consults a gynecologist. The gynecologist will be able to do an ultrasound and see the endometrial thickness, and she may be able to do a biopsy and see nothing is happening. But a postmenopausal bleeding episode should never ever be neglected by the lady. So these are some of the most dangerous problem in of menopause is osteoporosis. Their bones will become very brittle because the bone destruction is more than the bone formation in this age group. So they have to take extra care to keep up their bone density by taking calcium, and sometimes they have to take hormone replacement therapy with estrogens, because all the problems that happen in the menopause is due to the lack of a particular hormone, that is the female hormone estrogens. So they have to be supplemented in some cases. Okay, before this is all happens in the life of a female, starting from the newborn period up to the menopause. Before I conclude, I would like to talk about certain things about the preventive aspects of these problems to some extent. Say for example, in the childhood, I said sexual abuse is becoming very common. Children are getting raped. So a sex education is very important. A child has to have a sex education in the house by the mother. The mother has to. The ultimate concept is the child has to know what are her private parts. And she also should know that they should not be touched by any person, even the father. So when the child is made aware of these things, she will be definitely careful. In the house, this should happen. This should start in the house itself. Then in the schools also, this sex education should be a part of the school health programs. The teachers should teach the children, and they must make them aware what are their private parts and what should not be touched, because so immediately if somebody tries to do something, the child will be aware that something is going to happen, as it is already told by her mother or her teacher. So sex education is very, very important. Then comes the education about the menstrual abnormalities in the adolescent, because she should know that all the menstrual abnormalities that are occurring like dysmenorrhea, painful menstruation or heavy menstrual bleeding is abnormal. So that has to be taught by the mother if possible at home, and also in the school health programs. It should become a part and parcel of the school health programs. They should do periodic checkings of the children to see whether they are anemic, because anemia has got severe repercussions in the reproductive period, and many of the mothers die of anemia after the delivery. So that maternal mortality has to come down only by means of treating the adolescents and preventing the anemia. That's why WHO is very particular, and even the government of India is very particular to prevent the anemia. Then comes cancer awareness. Cancer awareness means what is happening. The female should know what is happening to her breasts. She has to self-examine her breasts every month, and she has to go for a clinical examination every 6 months to 1 year to a clinician to get her breasts examined. And then anybody after 40 years, every 2 to 3 years, they should have a mammogram. And after 50 years, it's almost every year a woman should have a mammogram to see that her breasts are normal. Then the cervical cancer is another cancer which is commonly seen globally, but that is very preventable by doing regular pap smears in the reproductive age group. Once the woman starts or the girl starts having sexual life, the pap smear also has to be started in her life. Every 3 years, a pap smear has to be done. In between, if the smear is found to be abnormal, the frequency should be increased like that, and the required treatment will be given by the clinician. And there is a preventive measure for the cervical cancer also, that is vaccination of the children. So the best age is 9 to 13 years is the best age before they start having the sex. Why I am telling sex is this cervical cancer is caused by a virus, HPV virus, that is transmitted through sex. So the vaccination, it's always better to get completed before the girl starts having sex. That is about 9 to 13 years, and 3 doses, 0 months, first month and 6 months. Within 6 months, the vaccination program will be over. So these are some of the preventive measures like sex education, prevention of anemia, cancer awareness, breast cancer awareness, cervical cancer awareness, and cervical vaccination. So I think I'm clear about the gynecological health concerns. Thank you very much.